Affairs Emergency Preparedness to order. Representative Stair, please lead us in the pledge. Jamie, please call the roll.
Chairman Solomon,
Here.
Representative Borowski, Representative Brown, Representative Genst, Representative Haddock, Representative Markozik, VBD, Representative Monroe, VBD, Representative O'Mara, Representative Pielli, Representative Sappi, VBD, Representative Scott, Representative Takak, Representative Webster, Representative Dan Williams, Chairman Gillen, Representative Benta, Representative Ham, Representative Krupa, Representative Mako, Representative Rigby, Representative Shalaba, Representative Stair, Representative Sender, Representative Wattrow, Representative Craig Williams. We have a quorum.
Thank you, Jamie. We are first going to cover the legislation, and then we're going to go into our briefing and discussion. First up is House Bill 1728, printer's number 2059, authored by Representative Jones. Representative Jones, please come up and present any comments you might have.
Thank you, Mr. Chairman. Thank you for considering this legislation. Thank you, colleagues, for having me. This is legislation that's actually moved through the House previously. It would add the Navy Club to the Veterans Commission. The Navy Club of the United States of America was established in 1938. It's been supporting our men and women of the Navy and the Coast Guard. Actually, they were congressionally chartered in 1941. The Navy Club is currently on the forefront of establishing recognition for Navy veterans who have experienced various forms of trauma, and it spearheads several other initiatives to ensure that veterans get the help that they need and deserve. This legislation has, as I said, passed several times before, just over the two previous sessions. It passed unanimously through the House both times. First is House Bill 980 in 2020, and again as House Bill 1057 in 2021. So by recognizing and supporting the Navy Club and the work that it does, as a member of the state's Veterans Commission, we can both strengthen the Navy Club and the Navy Club's efforts to help all the veterans and their families. They're also involved in upcoming, see if I say this right, semi-quincentennial, the celebration of our nation's 250th birthday. They'll be involved in that. They're involved in things like Fleet Week and other things across the state of Pennsylvania. So I appreciate your consideration of this legislation at this time. Thank you.
Representative Jones, thank you so much. I'll take a motion from Representative Krupa, seconded by Representative Takak, to bring up House Bill 1728. Are there any comments or questions from the members? We are also joined by Representative Craig Williams. Thank you. Chairman Gillen.
Yeah, thank you, Mr. Chairman. Thank you, Representative Jones. Long-standing request, heard a lot about this. Let's get across the finish line, get it to the governor's desk. Thank you, Mr. Chairman.
Thank you, Chairman Gillen. Are there any other comments or questions? Any negative votes? Thank you so much. We'll move House Bill 1728 to the floor for consideration. Thank you, Representative Jones.
Thank you all.
Next up, we have Representative Banta will bring up his bill, House Bill 1952, printer's number 2486. Before bringing up that bill, we have an amendment authored by Representative Takak, Amendment 04904. I will take a motion from Representative Genst, seconded by Representative Mako. Representative Takak, could you please explain your amendment?
Yes, thank you, Mr. Chairman. This amendment expands, the applicability of the bill to all public and private colleges and universities in the Commonwealth, and it also charges the Department of Education with developing and providing each institution a list of the military training sources and programs that are deemed qualified for academic credit.
Are there any questions, comments on the amendment?
I do have a brief question. Thank you, Mr.
Chairman
Chairman.
Gillen.
What's the anticipated timeline in order for the Department of Education to consummate that work?
Chairman Gillen, this is Mike Hillman, Executive Director. Department of Education didn't give us a timeline, but they did tell us that they are supportive of this measure with amendment. So they anticipate being able to do it. They just haven't given us the timeline.
Okay, thank you. Thank you, Mr. Chairman.
Any negative votes on Rep. Take X amendment? That amendment is adopted, and now we'll go to the bill. Representative Banta, any comments on your legislation?
Yes, sir. Thank you, Chairman. I guess when I got here, this bill was brought to my attention, and it from one of my colleagues from before, and I thought it was already in place. And so I'm working at home on a Veterans Wellness Center, and this falls right in line with that, getting guys out of the military and into civilian life. A gentleman up there from the Mellon family invested $4.5 million in a center, a college up there in Northeast, and this is going to be a great thing for those folks. So I appreciate your support here, and just know that it's about getting out of the military and getting back into the civilian world. So thank you for your support.
Any questions or comments on the bill? Chairman Gillen.
Yeah, I commend the maker of the bill, and I also compliment my colleague on the other side of the aisle for the bipartisan work that goes on in this committee. As you see here, these first two bills are on the minority side of the aisle. I also want to give a shout out to both the executive directors, Sean Harris and Michael Hillman, for helping construct some of this legislation, for their technical expertise and their approachability and their availability to all members of the committee. And so I think this should be an easy lift toward academic credit for the commensurate military training. Thank you, Mr. Chairman.
I appreciate that, Chairman Gill. And as we're trying to do sort of this military crosswalk where we're looking at both academic credit as well as civilian skills in the employment context, this is a great move in that effort, and I appreciate the makers' work on this bill. Any negative votes on House Bill 1952? Seeing none, it will move to the floor for consideration. Next up is House Bill 2010, printers number 2569, authored by Representative Webster. Representative Dan Williams makes a motion, seconded by Representative Shalaba, to bring up House Bill 2010. Representative Webster.
Good morning, and thank you, Mr. Chairman. Just a very brief recognition. The Veterans Trust Fund provides grants to a number of our nonprofits across the Commonwealth in support of veterans and community efforts to support those veterans. Typically, over time, those have been smaller grants, $20,000, $30,000, maybe some approaching $50,000. The intent of my bill is to provide flexibility in that grant program so that should there be a really important issue, maybe you could provide a larger grant. Should you have the opportunity to say, how do I plan as a nonprofit over 1 or 2 or 3 years, you might apply to accumulate those grants and put your program together in a more sophisticated way. So it's really just an opportunity to create more flexibility for the administration of the Veterans Trust Fund so that we're really focused on supporting veterans rather than just the math and the calculus. So thank you, Mr. Chairman.
Thank you, Representative Webster. Comments or questions for the maker? Chairman Gillen.
I applaud the concern over the 250,000 over a period of 3 consecutive years in terms of establishing that ceiling. Is this looking at a current problem, or is this forward thinking in terms of preventing a problem? For either the maker or the executive director.
So, Mr. Chairman, I am aware of some of the nonprofits that would like to ask for additional funding in short term versus, planning over 3 years. So this is sort of feedback from some of the nonprofit community that they'd like to be able to think in sort of out of the box how they put their programs together and be able to come in their grant requests to ask for, upfront funding or different ways to put their programs together.
And Chairman Gillen, I think from my perspective, I see this bill as sort of a way to begin a conversation about the Veterans Trust Fund. So meaning we push out a substantial amount of dollars. Let's make sure that those dollars are getting to our veterans who are in need of housing, financial assistance, recovery, treatment, all the issues that that the veteran community deals with, and maybe setting up some appropriate left and right limits on how we drive those dollars out. Who are the people making those decisions? This bill is an attempt to begin that conversation.
And I support the bill. Thank you, Mr. Chairman.
Thank you. Are there any negative votes on House Bill 2010? Seeing none, the bill moves to the floor for consideration. Next up is Senator Bartolotta's Senate Bill 438. Take a motion from Representative Craig Williams, seconded by Representative Pielli. Senator, please come up, provide your comments.
Good morning. Thank you, Chairman Solomon and Chairman Gillen, and the members of the committee for considering my bill. I really appreciate bringing this important legislation up for consideration. Throughout our nation's history, service and sacrifice have been the hallmarks of all of our veterans. Senate Bill 438 is a way to show our commitment to the entrepreneurial efforts of veterans throughout Pennsylvania, with the goal of increasing the awareness and thereby the success of their businesses. The development of a special logo to draw attention to these veteran-owned businesses is one simple way that we can show our deep gratitude. I ask the members of the committee respectfully to support Senate Bill 438. Thank you, Chairman.
Thank you so much, Senator. Before we get to the underlying bill, I'll bring up my amendment, 04941. I'll take a motion from Representative Mako, seconded by Representative O'Mara, to bring up my amendment. What my amendment, and to take your words, Senator, your bill seeks to draw attention to veteran-owned businesses. We as a Commonwealth are not seeking to say that we prefer veteran businesses to other businesses across the Commonwealth. This is simply to draw attention to those businesses. And so we just thought through an amendment we would underline that point. Any questions or comments on the amendment? Chairman Gillen.
I support the amendment, and I appreciate the comments, because we don't want to infer a state endorsement or that one business is offering a superior product or service, all the while recognizing that this is a veteran-owned business. And a lot of our colleagues, friends, family members, constituents take that into serious consideration when they're spending their hard-earned dollars. Thank you, Senator Bartolotta. Thank you, Mr. Chairman.
Thank you, Chairman. Are there any negative votes on the amendment? Seeing none, Amendment A04941 is adopted. On the underlying bill, any comments or questions? Chairman Gillen.
Thank you for being here, Senator Bartolotti. We appreciate your passion on veterans issues, and I think this is an exemplary product, and we look forward to having it implemented. Thank you, Mr. Chairman.
Thank you, Chairman.
Thank you. Are there any negative votes? Seeing none, Senate Bill 438 moves to the floor for consideration. Thank you, Senator, so
Thank you
much.
so very much.
That concludes our legislative portion. Now we're going to call up Deputy Todorsky, Deputy Fire Commissioner, to talk about our ongoing efforts to reauthorize the Fire Company Emergency Medical Services Grant Program, specifically the Fire Commissioner's proposal in that regard. And if you could also just start, Deputy, by giving the members an overview of your department, what you do, how you do it, who works in that department, so that then we can flow to the discussion.
Sure.
Thank you.
Thank you very much. Good morning, Chairman Solomon, Chairman Gillen, and members of the House Veterans Affairs and Emergency Preparedness Committee. I represent today the Office of the State Fire Commissioner and Commissioner Cook. My name is J.C. Todorsky. I serve as the Deputy State Fire Commissioner. Commissioner Cook regrets that he could not be here today, but he is finalizing arrangements for his mother's funeral. So in his stead, I'm here. I'll explain a little bit about our office. I have with me today Deputy Commissioner Harvey Boyer, who is my counterpart, who leads our operations in Lewistown at the State Fire Academy. The State Fire Commissioner's office has oversight over both the State Fire Academy and state training system for firefighters, and also a division here in Harrisburg that administers grants and our 2% loan program, is responsible for fire incident reporting statewide, and also has a recruitment and retention division, along with personnel assigned to community risk reduction, which is a new effort on behalf of our office. So that's the broad overview of our organization, and if it's okay with you, I'll now move into my testimony. Thank you for the opportunity to discuss one of our most important programs administered by our office, the Fire Company and Emergency Medical Services Programs Grant. Since its inception, the program has played a vital role in assisting the fire service and emergency medical services by providing much-needed funding to these organizations. As you know, the authorization for the program is set to expire at the end of the month. Since taking office, Commissioner Cook and I sought the input of the fire service community and the Fire Service Advisory Board to determine what updates should be considered as part of the reauthorization of the program to make it run better. With Governor Shapiro including in his budget address an additional investment of $30 million for the fire and EMS community, many of the conversations focused on where to direct those funds. Based on feedback we received and work done by the Office of the State Fire Commissioner, we've come up with high-level concepts to use the proposed funding if approved. The Office of the State Fire Commissioner would establish a new supplemental grant program utilizing the $30 million from the governor's proposed budget in the following ways. 50%, or $15 million, of the proposed increase in funding would be to increase the base amount available for approximately 2,400 fire and EMS companies that apply for the annual grant. Those supplemental awards would not count against the maximum grant limit currently in place in the Fire and Emergency Services Grant Program. 20%, or $6 million, of the proposed increase would be directed to a separate program for Department of Health licensed EMS entities that provide QRS, which is Quick Response Service, BLS, ALS, and Intermediate Life Support Squad services. There are currently 473 EMS agencies that are licensed by the Department of Health at the QRS or Squad level. These EMS agencies do not receive any grant funding for these services from our office, but provide vital services to stabilize patients until transport arrives. There are currently 17 agencies that provide squad-level services at BLS, ALS, and IALS agencies across the state. 4% of the proposed money, or $1.2 million, would be made available to specialty emergency service teams, such as wildland firefighting, rescue teams, and nonprofit hazardous materials teams. And 26%, or $7.8 million of the money, of the proposed increase would be to establish a competitive grant program for our counties or county-sponsored applicants to fund regionalization, standards of cover, or recruitment and retention efforts. We propose one grant per county or county-sponsored applicant to focus on these efforts in a regional per-county approach. Any funds not distributed through these various programs should roll over to the Municipal Fire Department and Training Center capital grant programs to augment the funds that are available there. For example, right now the Municipal Grant Program has $450,000 to distribute from the fireworks tax, and last year had $2,275,903.66 in eligible requests. So the program could see more funding. In addition to these ideas, we also are looking forward to technical amendments to ensure that we provide the best service possible to our stakeholder community, including giving the Office of the State Fire Commissioner, working with the Fire Advisory Board, the ability to award additional grant money to fire companies. During our conversations, we heard that companies wanted to focus on overall certification level of a department rather than individual certifications. Providing the Commissioner with the ability to issue fire department identification numbers to various organization types included in this grant program. Ensuring that fire departments receiving grant money are designated by at least one municipality as being responsible for emergency response. Ensuring that fire companies receiving grant funds are conducting appropriate clearance reviews on their members, and giving the Commissioner the discretion to extend the grant application deadline for the fire and EMS companies in cases of extreme hardship for up to 45 days. We remain willing to work with the stakeholder community and General Assembly to address any other concerns that may arise. Our goal is to ensure that there is no delay in opening the 24-25 grant application period in early September. Chairman Solomon, Chairman Gillen, and members of the committee, on behalf of Governor Shapiro, Commissioner Cook, and the 13 million Pennsylvanians we serve, I thank you for your continued support of the Office of the State Fire Commissioner and the Pennsylvania Fire and EMS Service. I believe that with the Governor's commitment and your continued support of our mission, Pennsylvania will continue to provide state-level support to our local emergency responders. I'm happy to answer any questions.
Thank you, Deputy. Questions and comments from the members? Representative Scott.
Good morning, Commissioner. How are you? I'm over here, sorry.
Okay.
I'm at the kindergartner table. I wanted to talk to you about specifically the competitive grant programs for the counties and in this program, and really get an idea of what kind of county-sponsored applicants are you guys envisioning for this program? And is this more along the lines of incentivizing for countywide operations?
The proposal from our point of view is to be able to fund studies and for counties to look at ways to promote regionalization, not necessarily pushing forward county-level fire departments, but to give them the opportunity to have funding for organizations within that county to begin to work together towards regionalization.
So communities that are looking to regionalize, would they have to have a county-sponsored applicant? So if I had 3 municipalities in my district that were looking to regionalize, they could not apply for the grant themselves. The county would have to apply on their behalf?
In our current proposal, yes, the money would flow to the county, who could then, in their application, have talked about the different types of efforts that they would be overseeing at the county level.
Thank you, Mr. Commissioner.
Thank you, Representative Scott. Representative Stender.
Thank you, Commissioner, for coming today. I do appreciate the opportunity to talk about this important grant program. I just have some questions about the numbers. I don't write as quick as you were talking.
Sorry.
No, that's all right. That's all right. How many QRS services do you think today don't qualify for
There
the
are-
grant program?
There are 473 EMS
Agencies
licensed agencies
that don't qualify.
that do not qualify for the current grant program.
So you think the 6 million would flow to those 473 agencies?
Yes, 6 million.
Okay. And you mentioned 17 QRS. Could you expand on that?
So the Department of Health in their licensure nomenclature talks about QRS being the basic first level, and then you can provide quick response services at a higher level of EMS license, have more equipment, have people trained to a different level. And once you move out of that basic QRS level, if you get to a BLS, intermediate ALS, or ALS, they're called a squad in EMS license nomenclature.
Okay.
So there are 17 agencies right now that operate above that QRS response licensure level.
You mean basic life support
You have
QRS?
BLS, ALS. There are some ALS squads where an engine has the appropriate equipment and paramedics staffing the engine that respond and provide QRS service at the ALS level, but they do not provide transport.
Okay. I think I understand what you're saying. There's no money here outside that county then to necessarily help with staffing issues that our volunteer and career services are facing.
Not in this proposal, no, sir.
Okay. And just so I'm clear with Representative Scott's question, the money for counties, it would have to be one of the 67 counties apply for it for them to distribute. Who within the county do you guys see as the point of contact for fire companies, or who, like, I mean, I'm thinking about my rural counties that are, I mean, I have a county that has 19,000 people. I mean, there's not really, I mean, outside of the commissioners, there's not other people within the county who even, I mean, the EMA coordinator, but he's already taxed with providing EMA services.
It could be the county EMA. It could be the EMA working in conjunction with the County Firemen's Association or Regional Association.
Is there examples of this already happening in the state of Pennsylvania?
Not that I am aware of.
Okay.
Representative Borowski.
Good morning, right here.
Okay.
Thank you so much for being here. I appreciate your testimony. I appreciate the work that has gone into this. So I guess my question is around the $6 million for the EMS companies. So do we think that's enough? Do we think that's enough? The breakdown with regards to that. So we talked about it's so $6 million. It works out to an average of about $12,000 per EMS. Do you think that having only $6 million dedicated to that is enough for what we need to do?
Obviously, I'm always going to be here to advocate for additional funding, correct?
I'm just wondering if the breakdown is
Yeah.
of what we've got.
So we worked with our counterparts at the Bureau of EMS under Department of Health to get some basic guideline figures of what it takes to equip a QRS service. And based on their guidance to us, that's how we arrived generally at the number of what will be used towards those QRS services.
Okay.
If you give us extra money, we'll take it.
Then just quickly on the existing fire and EMS grant program, was that reduced? Am I like, at one point, did the fire companies not get exactly as much as they had before? So take out this. Was that reduced? So last year or this year, did they not get as much as had been expected?
Well, this year they were eligible to apply for up to $20,000. As we ran the formula that currently exists, the maximum amount was slightly less than $20,000. But that gave us a target. The formula as it currently exists is a divide-by formula with some additional bonus points awarded for certification. And as we work through that process, this year we have more applicants, so that number was slightly reduced to where we thought we could get to.
So this funding, would that help, I guess, get us back to the level and then?
This funding doesn't affect that base. It would be additional on top of that.
Okay. On
So
top of
On
the
top
base
of
that
what they
already?
receive in their base grant program, yes.
Okay, what was already less than what we thought to begin with. Okay. And then I'm just going to ask about the split, the 88 fire, 12% EMS split. So that's 13.2 for fire and 1.8 for EMS. Is there any, I'm just looking at, I guess, looking to try to see if we can get some additional funding for EMS. Do you think that split is still good?
That's certainly something that we will be willing to discuss. Our proposal, as it stands, would keep that split the same right now.
Okay. Okay, thank you.
Representative Takak.
Thank you, Commissioner, for your testimony. Just following up on a couple of those concerns, particularly with Representative Stender. I mean, in those rural areas, QRS is critical. I mean, there's the distances involved, the density, really important. I'm a little worried that $6 million isn't enough. If I just do the math on it, it's about $12,500 roughly per squad. And then if you look at the $7.8 million for the regionalization effort, I mean, we have 67 counties. That's $116,000 for each of those. I just, first of all, are there any caps on that regionalization, on the $7.8 million? Are there any caps on individual awards there?
I don't know that that has been fleshed out at this point.
Okay. And then if I understand it right, if there are unused funds, those go to the Fire Academy.
No,
They roll over? Where do they go if they're not used?
They will go to the Municipal Fire Department Capital Grant Program and the Emergency Service Training Center Capital Grant Program. That Emergency Service Training Center is not our academy. That is the regional training centers across the Commonwealth.
So like the one in Center County,
Correct.
the fire training center
Yes.
that we use for
Correct.
qualification. Okay, all right. I just wasn't sure exactly where those additional funds would go. Just back to the $6 million, are there any use limitations on those? One of the things that I hear time and again is just the costs of training and certification versus even capital expenditures. Do you envision what those funds would be used for?
Are you talking the regional?
The $6 million for the EMS companies.
We anticipate that being operational costs or capital expenditures if they so choose.
Okay, so there's no limitations, there's no restrictions on using those funds?
That would be something that, if this is approved, we would work with the Fire Service Advisory Board and our partners at EMS to make sure that any restrictions were appropriate.
And if I might make a suggestion when that happens, one of the things I hear time and again is just the costs of going through the training and getting certified, that's a major barrier for many of these smaller companies, particularly in rural areas, as well as the availability of that training. They have to travel long distances in order to get certified and attend classes and those kind of things. Yeah, I I think for now, those are the only questions I have, but just a comment. I mean, our rural EMS agencies really do need a lot of help. And I think it's important for everybody to realize that when you travel on our interstates, or you go to camps, or you go to our state parks, you do not bring your level of fire and EMS coverage with you from your home. You are reliant on the services that are available locally, whether that's a small volunteer fire company that half of the squad is plain sect, like in one of my fire companies. You know, if you're on the interstate and you wreck, these are the folks who are coming to help you. And they do a wonderful job. They do an amazing job. They spend a lot of time and effort, and they're entirely dedicated to this. I believe that they really deserve our support. I'm very focused on making sure that we get them the help that they need. I just want to make sure it's going in the right direction. So thank you, Mr. Chairman.
Thank you, Representative Takak. Representative O'Mara.
Thank you, Commissioner, for being here. I wanted to echo the comments that Rep. Takak just made. I understand why there's a line item here for the grant program for regionalization, but frankly, I don't think the state is at at least the fire companies and the EMS companies that I'm talking to in my county, they're not ready to regionalize. And so I fear that while EMS is struggling so much right now, in our county, in Delaware County, our EMS providers tell us all the time if there was a mass incident, there wouldn't be enough ambulances ready to respond. Not that they don't have the ambulance, but they don't have the staff to staff those ambulances. And so I think what you're hearing from us is we see a bigger number towards a line item that's not ready, and $6 million is not enough for EMS. So if there's a way that we can fix that before this gets finalized, I think that's really important. And I also want to ask about the increase to the fire and EMS companies. Are we able to consider maybe with this additional money, some additional factors? Because Pennsylvania is a really diverse state in these companies are not serving equal populations. They're not serving equal geography. Their number of calls may change based on the land area that they're serving, or how dense their population is. And so I wonder if we can look at some other factors when distributing this money, because I understand why we do it the way we do it now, but if we're putting more money in and taking a time to examine, I think there's other factors that we need to consider. Thank you.
Well, can you comment on that?
My only comment would be we will work with the Fire Service Advisory Board to make sure that we're looking at appropriate uses and factors for the additional money. And we certainly hear your comments, and I will take them back to our office.
What factors are considered now? So there's a lot of discretion that the fire commissioner has. What are some of the factors when awarding those grants that the commissioner considers?
So we review their application to make sure it is one of the approved uses in the grant program currently. And really, it's not all that discretionary. It is a mathematical formula where we take the total grant funds available and divide and then award bonus points as appropriate. There's not much individual application review where we say, oh, that's a good project, we're going to give that more money. It is very formulaic.
But there are about 6 factors that the commissioner can consider now, and then there's sort of a discretionary one, a catch-all one. What I'm asking is, how does the commissioner currently use that discretionary? And then you mentioned bonus points. How is that factored in?
So currently, the bonus point program is individual certified members certified to the National Board of Professional Qualifications Firefighter 1 standard. And the company can submit up to 20 names of certified individuals, and then they receive extra money on top of their base grant allotment for those 20 certified individuals. What we're hearing from
Can
fire
you do that again? Sorry, I didn't follow that.
Yeah, I
Say
know,
that
It
again.
is quite confusing.
Yes.
So they submit a list of 20 certified individuals,
Who's they?
the fire company.
The fire company.
Right.
20 certified individuals.
Up to 20 certified individuals, and then built into our formula, each year when the calculation is run, each certified individual gives that application additional money. This year it was $194.55 per certified individual. What we're hearing from the fire service community is they would prefer us to not use individuals as certified, but look at the overall certification level of the department to award those additional bonus monies. So you may have a department that has 80 members and only 20 of them are certified, but you may have a department that has 30 members and all 30 are certified. And the fire service has pointed out to us many times that disparity of my whole organization is certified. We should be getting some extra for that.
Okay. Okay.
And that's
Represent-
one of the proposals we're going to take to the Fire Service Advisory Board and work with them to make sure that the methodology to do that is appropriate.
Thank you. Representative Haddock.
Thank you, Mr. Chairman. I think the committee would be remiss if we did not send our condolences to the Fire Commissioner Cook and his entire family. Sorry to hear the news. Some of the questions that were asked, the big surprise here to me and several of our state representatives seems to be the county allotment of the $7.8 million and 25% of the pot of money approximately. And I'm sure you did some due diligence and said what is needed. But again, who's going to administer this money in the county? Did you reach out to CCAP or any of the county commissioners and find out what their thoughts would be about? I'm sure you, and there's probably an element, everybody is short-staffed in today's world, it seems, including your own department. So instead of keeping this money in under control of the fire commissioner, we're kicking it out to the counties. Did we do any research with that?
Yes, I know that Commissioner Cook is very active with talking to the various statewide municipal organizations, including the county commissioners. I personally don't know what conversations he had with them, but I know he's very active talking to those municipal groups. One thing that I just wanted to loop back and stress is we spoke about the grant at the county level being used for regionalization. It will also be able to be used for recruitment and retention at the county level. So it's not just regionalization. If I left you with that impression, I'm sorry. It's also recruitment and retention efforts.
Well, I think we all know that regionalization, certainly with the advent of how our volunteer services are struggling so much, it's certainly a way to go, and but getting there is always the problem. So I'm glad to hear there's other elements within that funding. But again, now you have the county looking for recruitment, and I believe you said there's only one application per county. And again, there's a lot of details here for a major plan rolled out, but who is going to get the money for recruitment now? Another question.
Again, it would go to that county-sponsored applicant to try to make that money available in a regional manner.
Okay. Again, so we all know about the fire in my particular region. I mean, obviously, volunteers they're struggling, and we know that we have another. And I hate to use this word, pandemic, because it is that bad throughout Pennsylvania and throughout the country for volunteer firefighters. But the second wave, I think, that we don't hear about as much is the EMS. Again, a different structure because many more are paid, but we're not getting the people into those departments. And I'm just thinking for recruitment and retention and salary, rather than go through a county level and you know, giving more to our EMS directly to let them put out the, to use the terminology, immediate fire that they're struggling with. I mean, I have talked to EMS after EMS, and I'm hearing they can't hire. And I don't know that the county approach and putting money into the county and then having that argument there, I think I'd like to see more money in the EMS portion thereof. Thank you.
Thank you, Representative Haddock. Back to Representative Stender.
Just so I'm clear, Commissioner, the 20,000 that each individual fire company can apply for, we don't see that number getting raised in this bill.
No.
Okay, that's concerning. Just because, I mean, we have this opportunity with the governor to put more money in. I know Commissioner Cook came to my volunteer fire company and specifically said, more money, there's going to be more money available. So the issue that I see, and this also goes along with some of the bonus points conversation we were having, is we're almost at $20,000 this past year in the grant program, right? You're basically already awarding that. So the only way then for my volunteer fire companies, and I have no career fire companies in my 65,000 residents. So what I'm hearing then is the only way for my volunteer fire companies to potentially get more money is through professional certification.
No.
Because of the bonus point structure, right?
This proposal, as presented, would take that 15 million and divide it amongst all applicants. They would still apply for their $20,000 base as they did this year.
Yep.
And then this money would go on top of that.
How would that be awarded?
A simple divide by formula based on number of applicants.
So then the professional certification wouldn't affect that?
No, it would affect that base amount as
The
it has in the
$20,000.
past, yes.
But then you're saying you want to expand the opportunity. You're hearing that you want to expand the opportunity for the professional certification bonus money.
We want to calculate it in a different manner than individual certification. We want to look at the certification level across the department.
Yeah, and that's what's concerning to my constituents. And I'll say this, I know from my past experience, I hold a lot of the certifications that you're probably talking about. I was very fortunate. I worked for a career fire department where we did 1001 certification, we did 1006 certification. It was encouraged. We were rewarded for it. However, my volunteers, you know, one of the issues we have with getting and recruiting and maintaining firefighters is training requirements and lack of availability of training. So it's very concerning to me to hear that on one hand, we've heard for the last 5 months, hey, we're getting more money. And now I feel like what I'm essentially hearing is my volunteer fire companies potentially are only getting more money if we have professional certification behind that. And that's what, I mean, that's what Firefighter 1, Firefighter 2, Fire Officer 1, Fire Officer 2, the 1006 certification through Confined Space Awareness Operations Technician, Hazmat Awareness Operations Technician. I mean, those are the programs that we're talking about when we're talking about professional certification. And those programs are very costly to a system that's already underfunded. And then on top of that, the demands to pass those certifications become very hard on people who are already working 40 hours a week to provide for their family and are just trying to volunteer for their local community. That's very concerning to me. I would echo the comments of everybody else here is, you know, to me, the extra 30 million, I would just like to see it put on top of the program. Maybe if we're expanding anything, I would like to see maybe an expansion of the opportunity of what my volunteer fire companies can really spend that money on. In this world of, we just lived through some hyperinflation, my fire companies are hurting to pay their electric bill. They're hurting to pay their gas bill. They're hurting to maybe put more efficient garage doors on their stations. You know, these are the things that, you know, I'm hearing from my volunteer fire companies that are really the issue. I thought that there was already money available for mergers, consolidation through DCD. You know, I thought I've heard from DCD that really they're having a problem getting fire companies to call DCD to help them with consolidations, mergers. You know, really, I guess what I'm hoping, you know, and maybe we can work through this prior to June 30th, but you know, we're really looking for an opportunity that fire and EMS agencies are able to get more than 20,000 or 15,000 through this opportunity of more funding from, you know, the budget. So I appreciate the opportunity. Thank you, guys.
Anything?
I'm not sure that I've been clear with how that additional 15 million will be used. Your company would still get their base $20,000 grant. And then there's a divide by for the additional funding. So they may get the 20 that they applied for plus an additional, and I'm not going to quote a number, but whatever that $15 million divided by the number of applicants, that sets on top of their base grant. So they would be getting more money.
Okay, so we have, just to let the members know, we have Representative Borowski, Representative Scott, Takak, O'Mara, Chairman Gillen, and we have to be out of here in 10 minutes. So folks need to be really fast in asking these questions or comments. Representative Borowski, quick, please.
I will be quick, I promise. Thank you again. I'm here. So my question is, and to kind of tag on to what Representative Stender said, is the use of the funds. So one of the things that I hear from my fire companies, and I'm in Delaware County, so very suburban, very busy. I have 4 fire companies and 2 EMS in my district. They're struggling with paying career staff. So during the day when volunteerism is really low, they are supplementing with career staff. Is there a way to extend the use of this funds, or could it be used now to help pay for career staff? And also my other question.
We just got one, I'm sorry. Can you answer that, Deputy Commissioner?
Thank you.
Currently, money cannot be used for staffing. However, that is something that we are willing to discuss.
Representative Scott, as quick as you can, please.
Thank you. Just a question about jurisdiction over EMS, and I know EMS has been bought into this. I just want to know clearly, like, what are you guys, what is your jurisdiction over that? And then the last thing I'll just say is that we need to make sure that we give more money for personnel. We need our own version for the PA Safer grant. It makes no sense to me why we don't have equity in terms of the level of service across the Commonwealth. We shouldn't have that, and I think we need more money for personnel. And I can get his response later. He can email me.
Okay, thank you, Representative Scott. Representative Takak.
Thank you, Mr. Chairman. I'll be quick as well. I just wanted to echo support for EMS is really crucial. They're struggling. We have rollover calls. The service times are really difficult, particularly in rural areas. I think calling out specific money for those regional fire training centers would also be key. We've talked about the availability of training. In our situation, the more ongoing training that is available and can be received and can be afforded, it actually helps with retention in particular. So anything we can do to support those regional fire centers, I think, would be crucial. Thank you, Mr. Chairman.
Representative O'Mara.
I wanted to ask, and you can please follow up with me later, but you keep saying $20,000, but the reality is only 7 fire companies actually received $20,000, so the grant structure in itself is somehow punitive. And I would also add that I think basing it on the number of professional firefighters, while I understand, it's really challenging and expensive, especially for companies that are so volunteer-based. And for the life of me, I can't understand why bonus points aren't awarded on more concrete effort in responding to calls or miles covered or things like that. So I would just really urge us to take some time and please listen to these comments. Thanks.
Representative Watro.
Thank you, Mr. Chairman. Commissioner, thank you for your testimony. My only thing, I more or less have a statement. The 20K as a base payment to our local firefighters is not enough. I meet with them regularly on a weekly basis, and they're struggling, they're hurting. Just this coming weekend, they're having their annual bazaar, flipping potato cakes, making pierogies, just trying to raise money. They're hurting, they're struggling. That 20K definitely needs to increase a lot. Thank you. Mr. Chairman.
Thank you, Chairman Gillen.
I have 12 questions and 5 comments. Now, on page 13, very briefly, extending the application process, what sort of stakeholder feedback have you gotten on doing that?
Can you repeat the question, sir? I'm sorry.
Extending the application period, getting stakeholder feedback on that.
Currently, the application period is locked in legislatively at 45 days. There occasionally is an issue where an organization undergoes a hardship, a member that was responsible for the grant application in the middle of the application period passes away, becomes severely ill, can't complete it. We currently have no means of extending it legally. This would allow us to extend that application period in those hardship cases.
And I appreciate that. And I join the EMS Amen corner. I appreciate the Commissioner, the administration taking on robust increases. Thank you, Mr. Chairman.
And I would just point out that if you want to increase the amount of money, we will give out more money. We will give out everything you give us. So.
Deputy Commissioner, Chairman, members, thank you so much. This meeting is adjourned.